If you're suffering from pimples over the female private parts, the genitals, then this video is for you. In this video, I'll go over the many different conditions that can cause pimples over the female private parts or the genitals. We'll look at every condition, talk a little bit about it, give you a sense of what is causing the condition, and ultimately make some recommendations as far as what you can do. Before we get started, don't forget to hit the like and subscribe button and hit the notification bell for notifications of future episodes. Now let's get started. So pimples over the female genitals can be caused by many different conditions. First and foremost, folliculitis. Folliculitis, or inflammation of the hair follicles, can be caused by many different factors. There's the idiopathic folliculitis, then there's bacterial folliculitis that is caused by bacterial overgrowth over that affected part of the skin. All these different causes, the first one, which is idiopathic, meaning of unknown cause, bacterial overgrowth or yeast, can lead to the same phenomenon, meaning pimples and pustules over the affected area of the skin. That includes the female genitals in many cases, and that needs to be specifically addressed considering the causing factor. The idiopathic kind of folliculitis, many a time, is addressed by gentle skin care and can respond to antibiotics even if there's no infection involved. Then bacterial folliculitis needs to be addressed by antibiotics or antibacterials that are applied over the area. In some cases, you may need systemic antibiotics. And then the yeast-mediated folliculitis must be addressed with anti-yeast or antifungal medications. Then there are razor burns and pseudofolliculitis. These are usually caused by shaving or traction over the hair follicles. This is usually related to hair removal practices that are causing much friction over the area, leading to irritation of the follicular units and persistent inflammation and discomfort over the area. And changing your hair removal practices or throwing them out altogether, stopping and removing your hair from the area, and that can lead to resolution of your symptoms. Hidradenitis suppurativa that I've discussed in previous videos is a chronic skin condition, inflammatory idiopathic skin condition leading to pimples and boils over the skin folds that can affect the female genitals as well and can lead to pimples into large boils, large painful boils, and eventually to scarring over the area. That condition must be diagnosed quickly to avoid long-standing and persistent damage over the area and obviously get you the relief that you need. So see a board-certified dermatologist to diagnose your condition, come up with a management and treatment plan, and follow up in a timely fashion to make sure you're getting better. Cysts, specifically what we call Barthold's cysts, are due to clogging of pores of glands that are found naturally on the labia majora of the vulva. These can sometimes become clogged and inflamed, and that can lead to swelling over the area, over the labia majora, to significant pain, and can sometimes even become infected if there's bacterial overgrowth over the area. That can sometimes be managed with gentle skin care and antibiotics, but in certain cases that may require surgical intervention to make sure that the mechanical issue, meaning clogging of the cyst access point, is addressed and your condition is resolved. Then there are the STD category, specifically conditions like herpes simplex viral infections that can lead to actual folliculitis and pimples over the area, usually over a limited area and in a recurring fashion, meaning the infection is going to recur over the same location over and over and over again. That could be a good clue to the fact that you're suffering from herpes simplex virus infection. That can be addressed with gentle skin care and obviously antivirals to prevent episodes from appearing in the first place, to suppress future episodes from appearing if they recur often, and obviously cut short episodes that are already ongoing and achieve resolutions of your symptoms. And then there are the non-infectious, non-inflammatory entities that can lead to multiple bumps over the labia majora that can look like pimples but are not pimples. Specifically, several conditions that can lead to that sort of appearance are Syringomas, sebaceous hyperplasia, and angiokeratomas, all of which can lead to bumps over the labia majora. They must be diagnosed, obviously, and you need to get a bottom line to make sure you're not dealing with any sort of inflammatory condition and are not spinning your wheels trying to treat an inflammatory condition to no avail, as no medication is going to make these better. These are types of skin lesions that are usually left alone, and if they bother you as far as appearance is concerned, as far as aesthetics are concerned, sometimes they can be addressed by destruction of those lesions with techniques that are available in the clinic. Finally, beware of the persistent pimple over the labia majora. Persistent pimple over one area can be a sign, albeit rarely, of skin cancer, specifically squamous cell carcinoma, basal cell carcinomas in rare cases, and other skin cancers. So if you have a recurring or a persistent cystic lesion over the labia majora, make sure to get it evaluated by a board-certified dermatologist so you can distinguish between infectious conditions, cystic conditions, other conditions that are neither infectious nor cystic nor inflammatory, and obviously skin cancer. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and tell me, are you suffering from any conditions along the lines of what I've described so far? If you do, put a comment in the comments section. Go see a board-certified dermatologist and get relief for your symptoms. Now let's continue. So what can you do? Obviously, you do need to consult a board-certified dermatologist who has expertise in evaluating skin lesions over the privates and treating them as best as possible. But you can actually do some things at home, and I've discussed this time and time again in many episodes on my show. First of all, do no harm. Very, very important is to realize that even if you're suffering from an infectious or an inflammatory condition, skincare, gentle skincare is of paramount importance. You need to back away from any cleansing rituals, anything that's supposed to disinfect the area. All these practices across the board, from hot water, detergents, any physical abrasives of any kind, and then the disinfecting practices such as application of antibacterials, antiseptics such as alcohol, hydrogen peroxide, and application of things that you find in your medicine cabinet blindly applied to the area can all lead to worsening of your symptoms, worsening of your conditions. It might actually lead to new irritation over the area that can complicate your condition with additional irritation over what's already going on. So back away from any abrasive practices over the area. Do not make your condition worse. The best care you can apply to the area is lukewarm water rinses. Don't use any antibacterial soaps unless actually advised by your dermatologist to do so. Use gentle soap to wash the groin folds, and you may actually approach the labia majora, but do not go inside the privates to wash with soap. That's going to upset the mucosal surface. It'll offset the pH and offset the microbial population already residing over the area, which may be compromised, but could be far more compromised once you hit the area with detergents. See a board-certified dermatologist for your persistent condition to evaluate the area. If you've enjoyed this video, share, like it, subscribe, and hit the notification bell to get notifications of future episodes. Thank you so much for watching. More great content coming your way right from this channel. Thanks for watching, and God bless.